As an Arctic blast grips much of the United States, hospitalizations for respiratory illnesses like COVID are on the rise in more than 30 states.
We're all back on the trains and the buses, so we're back to face-to-face contact. So yeah, people are getting sick.
Yeah, I would say COVID is more or less a concern, along with influenza and RSV.
Death rates have ticked up too, though they do remain far below the COVID pandemic peak. The trend is the same in Europe and other parts of the world.
We still have around 10,000 deaths per month, and that's only data from 50 countries. Among those 10,000 deaths reported in December, more than half were reported from the United States of America, 1,000 from Italy.
Fewer than 20% of American adults have received the latest COVID vaccine, however.
I didn't get this latest one because I heard that it's making people sick and everything.
Health officials warn that puts vulnerable individuals and healthcare systems at risk. Here in New York, once the epicenter of the COVID pandemic in the United States, mask mandates have been reinstated inside public hospitals and for medical first responders, an attempt to slow the virus's transmission. New York has also launched a study of 10,000 people to better understand COVID's long-term impact on the body.
We have a lot of evidence that COVID affects a number of our systems, whether it's your endocrine system, your heart and your lungs, your brain, your blood vessels. But we don't know what the long-term implications of that. And longitudinal cohort studies like this one have been effective over time.
As doctors try to understand the true impact of long-term COVID, one thing is certain: caution is still needed to keep the vulnerable safe. Kristen, Saloomey, Al Jazeera, New York.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.